The top stories tonight in Y News. The Indian government orders crackdown on hospitals flagging oxygen and bed shortage.
The expected arrival in the Philippines of the initial batch of Sputnik V vaccines from Russia faced another delay.
Some Filipino lawmakers are planning to distribute Ivermectin drugs to the public. Government news agencies are ordered to convey that the Philippines is faring better than other countries in handling the COVID-19 crisis.
Curfew hours in Metro Manila to be shortened starting May 1st.
And a Quebec woman dies due to blood clot linked to AstraZeneca vaccine. Good evening, Philippines and the world. Today is Wednesday, April 28, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. With the overwhelming second wave of coronavirus infection comes the controversy of the Indian government not just playing down the crisis, but also targeting hospitals and individuals reporting shortage of oxygen. Marvy Delfin will give us the details live. Yes, Marvy?
Arlene, a crackdown was ordered by the Bharatiya Janata Party government in Uttar Pradesh state in India on individuals and hospitals flagging a shortage of oxygen and hospital beds. According to local reports, Chief Minister Yogi Adityanath of Uttar Pradesh state has threatened to use the National Security Act and the Gangster Act against anyone who spreads such panic during the surge of the COVID-19 pandemic. In a conference on Monday, according to Adityanath, there is no shortage of coronavirus medical needs, claiming that his government has 32 oxygen plants. However, officials in various cities with over 30,000 COVID infections per day said otherwise and has reported that they are facing a shortage. Adityanath, who is currently with COVID-19 infection himself, was condemned by a regional court for his government's handling of the crisis. Meanwhile, India reported a record daily death toll as total COVID-19 fatalities crossed the 200,000 mark. Government data showed at least 3,293 people died over a 24-hour period. Overall cases also rose by a record 360,960 reported infections, marking India's 7th consecutive day of over 300,000 new infections. The country's total number of COVID cases is just below 18 million, while the death toll stands at 201,187. Back to you, Harleen.
Thank you, Marvy Delfin, for those updates live from Australia. The supposed arrival in the Philippines of the initial 15,000 doses of Sputnik V COVID-19 vaccines developed by Russia's Gamaleya Research Institute has been moved again next month. Nel Maribuhok will tell us why live. Yes, Nel?
Arlene, due to logistical challenges, Russian-made COVID-19 vaccines will not arrive in the country this month. Malacanang spokesperson Harry Roque explained that the delivery of Sputnik V vaccines has been cancelled because there were no direct flights from Russia. He also said that the vaccines were required to be stored at a temperature of -20 degrees Celsius, a requirement that cannot be met for now. Roque nevertheless assured the public that vaccine czar Carlito Galvez Jr. has taken steps to address these challenges and aim to receive the first batch of Sputnik V vaccines in May instead. In 2021, the Food and Drug Administration approved the emergency use of Sputnik V. Based on its phase 3 clinical trials for age 18 and above, Sputnik V has more than 91% efficacy. Sputnik V, like AstraZeneca, is a viral vector that utilizes different harmless virus which delivers instructions to our body to fight the COVID-19 virus. This is a two-dose vaccines with 21 days apart. According to the FDA, vaccine experts panel believes the greater benefit of the said vaccine than risk.
Sputnik is it's an adenoviral vector vaccine, no? Kakaiba siya doon sa iba kasi iba yung kanyang component 1, tapos iba yung kanyang component 2. Yung first dose niya ay ibang vector, tapos yung second dose niya ay iba yung vector na ginagamit. Kaya mas mataas daw ang ito yung naisip nilang dahilan kung bakit mataas yung kanyang efficacy. The efficacy reported in the studies, yung early clinical trial phase 3 is mga more than 90%. So it's a vaccine that has passed our vaccine expert panel at they believe that the benefit of using it is greater than the risk. At ito ay pinapayagan gamitin sa mga tao 18 and above.
Some of the common adverse effects of the vaccine are hypothermia, headache, muscle and joint pain, sore throat, cold and cough. No serious adverse events have been reported so far. Arlene?
Thank you, Nel Maribohok, reporting live.
Despite cautions from government agencies and health experts on its use, lawmakers are planning to mass distribute the anti-parasitic drug Ivermectin to residents who are in dire need. Ray Pelayo will tell us why.
A mass distribution of the anti-parasitic drug Ivermectin will be first held in Quezon City, where the highest number of COVID-19 cases are recorded, like in Barangay Old Balara. One of the campaign's proponents, ang Nakalusugan Party List Representative Mike Defensor, believes that Ivermectin can be a big help to prevent an individual from getting infected with COVID-19, and it can help treat a patient as well. Defensor vouches on the efficacy of Ivermectin based on his personal experience being a COVID-19 survivor. Until now, the lawmaker is continuously taking the drug. Defensor is confident that their campaign will go smoothly as they promise to adhere with government protocols.
Una, talagang merong compounding laboratory na license which is allowed by FDA. Pangalawa, may doctor's prescription. Pagka naman ginipit pa nila kami, talagang super na. Parang ayaw na talagang mabigyan ng mga tao.
Meanwhile, the concerned doctors and citizens of the Philippines or CDCPH, along with the local government of Quezon City, will conduct a study on how Ivermectin helps in the condition of an individual. The group targets observed to 500 individuals for the study under a doctor's prescription and with patient's consent.
Mabibilang namin ngayon kung yung bang mga uminom ng Ivermectin, gaano kadalas sila magkasakit ng COVID. O kaya kung ay tanong sakit, ibibilangin na rin namin kasama doon sa forms.
CDCPH said that based on previous studies in Ivermectin, there is a big chance that a person can get protected from COVID-19.
Doon sa studies na napag-aralan namin is it actually shows more than 80% efficacy for prophylaxis. Ganun rin halos yung early treatment. So yun ang mga ini-expect namin na matulungan.
The group of doctors call on the national government to grant Ivermectin an emergency use authorization so that more people can benefit from it. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
Meanwhile, the Food and Drug Administration sees no violation on the plan of some groups to distribute Ivermectin drugs to the public. However, the Department of Health says there is no evidence to support the use of Ivermectin to prevent or treat COVID-19. Aiko Miguel will tell us why.
A health professional's supervision is needed on the user intake of Ivermectin against COVID-19. According to Food and Drug Administration Director General Undersecretary Eric Domingo, it is not prohibited to use Ivermectin as long as a doctor will be responsible for whatever happens to a patient.
Basta naman merong doktor, tapos yung doctor titigit sa pasyente and prescribe medicine and explain to the patient, then wala namang problem yun. Kasi lahat naman ng doktor merong karapatang magreseta sa pasyente at ang pasyente naman ay may karapatang magpatingin sa doktor na nanaisin nila. So as long as assured naman yung safety ng mga pasyente, then I don't see any problem.
DG Domingo also explains a doctor doesn't need to seek a compassionate special permit to the FDA to prescribe Ivermectin as a drug against COVID-19, but it has to be bought in licensed compounding pharmacies only. A compounding pharmacy is a pharmacy with a special permit to do compounding. They compound the medicine per patient prescription.
Pero yung mga private physicians, yung mga doctor, pwede pa rin silang magreseta sa pasyente nila, and the patients, for example, can get this drug through mga compounding na licensed pharmacies na licensed by FDA.
On the other hand, Compassionate Special Permit or CSP is given to hospitals to import drugs registered in other countries and will be used for patients in hospitals with COVID-19 infection. FDA refutes the statement of former advisor to the National Task Force, Dr. Antonio Liachon, that they have lost moral courage and authority by allowing the use of Ivermectin for COVID-19 patients in the country.
Well, hindi naman tayo kasi pantay-pantay naman ang paningin natin kung ano lang yung rules and regulations, no? So, hindi naman tayo pumipili ng kung, like for example, hindi kami nagsasabi na pro-Ivermectin kami or anti-Ivermectin kami. Kailangan lang regulated. So, for hospitals who want to import a product that is unregistered, pwede silang kumuha ng CSP. Yun naman mga pharmacy na nagko-compound, pwede na silang kumuha ng license to compound the medicines. And of course, doctors naman na merong lisensya, maaari silang mag-resetan.
But the Department of Health warns that not only doctors or medical professionals are liable when anything unfortunate happens to patients. People who are unauthorized to sell and distribute it are liable for any violations against the law. The DOH reminds the public there is no enough evidence yet that Ivermectin is effective against mild to severe COVID-19 infection.
Still, sinasabi nila insufficient pa rin ang evidence para i-recommend natin ang Ivermectin in the treatment for mild to moderate COVID-19 patients. And there is that remark na very low ang quality of evidence. The second, meron ding suggestion against the use of Ivermectin for the treatment of patients with severe COVID-19. Again, this is a conditional recommendation from them because of the very low quality of evidence found across the globe.
In a statement, the World Health Organization advises Ivermectin can only be used to treat COVID-19 under clinical trials. In the country, the government plans to conduct clinical trials of Ivermectin, spearheaded by the Department of Science and Technology. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippines' tally of novel coronavirus disease infections has climbed to 1,020,495 after the Department of Health, or DOH, reported 6,895 additional cases today in its 4 p.m. bulletin. The DOH said the latest tally pushed the country's total active cases to 67,769. Of these cases, 94.9% are mild, 1.6% are asymptomatic, 1.4% are severe, and 1.1% are in critical condition. The agency, however, noted that the lower case count is due to the low testing output of laboratories last Monday, April 26, and does not mean that the public should become complacent. The DOH also announced 115 new fatalities, raising the death toll to 17,031. Total recoveries climbed to 935,695 after 10,739 more patients recovered from the viral respiratory disease. The Presidential Communications Operations Office, or PCOO, confirms the circulating internal memorandum for government media being directed by President Rodrigo Duterte to carry regular updates about world data on COVID-19. This is to convey to the public that the Philippines is faring better than many other countries in addressing the pandemic. Rosalie Cos reports.
There's nothing wrong. It is not a lie and simply amplifying the facts. The Presidential Communications Operations Office or PCOO confirmed the leaked internal memorandum for all government media platforms through PCOO Integrated News Team Director Virginia Arcilia Agtay. The memo says, according to the directive of President Rodrigo Duterte, all government media platforms are directed to carry regular updates about the world data on COVID-19, specifically to convey to the public that the Philippines is faring better than many other countries in addressing the pandemic. Director Agtay said the President has given the instruction in order to provide adequate information and convey working policies, particularly those that aim to address the effects of the pandemic in the country. The palace has reiterated that compared with other countries, the COVID-19 situation in the country is more manageable. According to presidential spokesperson Harry Roque, though we have more than 1 million total number of COVID-19 cases, most of this have already recovered. Based on the latest data of Johns Hopkins University CSSE, the Philippines is 26th on global COVID-19 cases and 30th on global COVID deaths. Roque also reiterated that our case fatality rate is lower than the world average. But based on the report of the Center for Strategic and International Studies, the Philippines has the highest number of new cases for the last 24 hours in Southeast Asia and the second highest in the total number of COVID-19 cases and deaths. Meanwhile, we are on the 7th spot on the percentage of people fully vaccinated against COVID-19, just next to Singapore, Cambodia, Indonesia, Malaysia, Laos, and Thailand. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching us on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
Metro Manila mayors have issued a resolution imposing shorter unified curfew hours beginning May 1. However, they are reluctant in shifting to General Community Quarantine or GCQ next month. Asher Kadapan Jr. details why.
Metropolitan Manila Development Authority Chairman Benjamin Benhar Abalos Jr. explains that extending curfew hours equates to longer business operation, thus allowing more livelihood opportunities, especially to citizens affected by the crisis brought about by the pandemic. With this, the Metro Manila Council issued a resolution to implement a new unified curfew hours across the National Capital Region starting May 1. From the current curfew hours of 8 p.m. to 5 a.m., the Metro Manila mayors agreed to shorten it from 10 p.m. to 4 a.m.
Kasi usually kung pupunta ka ng mall, siguro ba yung mga 6:30, 7, sarado na yan eh. Dahil 8 o'clock, curfew na eh. At least ngayon, ang mall hours mo hanggang 9 o'clock ka or hanggang 8 o'clock ka, hindi ba? Mas marami kang chance na magtrabaho ng mas mahaba na 8 hours.
Chairman Abalos further explains that this complements the Metro Manila Mayor's recommendation to open additional business operations while retaining the implementation of modified enhanced community quarantine. He also explains that the local chief executives in the region are hesitant to shift to general community quarantine as they target to maintain the decreasing number of COVID-19 cases in the metropolis.
Ang kinakatakutan ng mga health experts ay baka magkalat ng impeksyon kung bubuksan natin, kung gagawin natin GCQ. Pero kung di mo naman bubuksan ng negosyo, ang mangyari naman, marami namang walang trabaho at marami nagugutom. So ang ginawa natin ay gitna. We found the middle ground. Ibig sabihin, we will be retaining the MECQ, yung ngayon, pero with additional business openings.
The Council of Metro Manila Mayors likewise agreed to have a stringent border control, refusing entry and exit of non-essential travels in the NCR Plus bubble. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
The Octa Research Group hopes the extension of the Modified Enhanced Community Quarantine, or MECQ status, will sustain the downward trend of COVID-19 cases in the National Capital Region. Rosalie Cos will tell us why.
The Octa Research Group supports the findings that the stricter community quarantine is effective in controlling the further spread of COVID-19 within the NCR+. And for the research group, if other businesses and sectors will be reopened under the flexible Modified Enhanced Community Quarantine, or MECQ, proposed by the Metro Manila Council, super spreader events should be avoided. There should not be also high-risk activities.
Ang amin hope lang is that the businesses that will open, that will be considered open during this modified or this hybrid MECQ, ay hindi magkakaroon magdadagdag sa super spreader events na they won't become super spreader or create risks for spreading or further transmission of the virus.
From the peak of 5,500 cases during the COVID-19 surge in Metro Manila, it has decreased to 3,500 daily cases. However, this trend must be further decreased to 2,000 daily COVID-19 cases and sustained to decongest hospitals in the capital.
If it's over 3,000 cases, mapupuno pa rin po yung mga hospital natin. Kaya kung mas matagal po yung ating healing period, yung exit strategy natin sa MECQ, maybe 1 or additional at most 2 weeks, makikita natin na talagang bababaho yung daily number of cases po natin, bababaho yung reproduction number natin, yung hospitals natin makikita mo luluwag talaga siya.
The Octa Research also warned against abrupt easing of restrictions to general community quarantine over the NCR+ because of the possibility of reversal of COVID-19 cases trend. Tonight, President Rodrigo Duterte is expected to decide and announce the community quarantine classifications for the month of May. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
A group of garment exporters in the country is asking the government for help to give financial aid to its factory employees affected by the pandemic. The Labor Department says they have requested for additional funding to continue its program to such workers in the country. Arlene Delgado will tell us why.
A year into the pandemic, many sectors that were hardly hit by the crisis are still trying to get back on its feet, and one of them is the garment industry. During the Senate Committee on Economic Affairs hearing, the Confederation of Wearable Exporters in the Philippines, or CONWEP, has asked the Department of Labor and Employment to help some of their workers in the industry that have yet to receive financial aid.
We're really still trying to solve it. They have this clamor, why are we eased out? Why didn't we get it? The workers are really nag-iinit. Every time you talk to them, going around the factories recently, it's really coming out strong.
The Labor Department admits that they have limited funds for its assistance to affected workers. For formal workers, DOLE has COVID-19 Adjustment Measures Program, or CAMP, which is a one-time financial aid of 5,000 pesos. Last year, the department was only able to serve 600,000 workers out of almost 2 million employees who applied for the program. In the manufacturing sector, DOLE granted subsidies to 111,000 workers from 1,361 establishments. The agency says they have already requested for additional funding to continue the program.
We prioritized micro, small, and medium enterprises po. We also catered to the large companies, but very limited po. Tama po yun.
Meanwhile, CONWEP is also urging the government to purchase locally made personal protective equipment, or PPEs. The CONWEP was tapped by the government last year to produce PPEs to meet the local demand for healthcare workers in the country. The group says they are now looking into exporting PPEs to continue their operations and support jobs.
We were subjected to the lowest cost, and unfortunately also at that same time, the Philippine market was flooded with very low cost PPEs from China. Some of them are even substandards.
Magandang tignan at baka may cartel din who's trying to get all this contract para mas nahihirapan yung local market natin makapasok dito sa pagsusupply ng PPEs. Yeah, nakakatawa, no? Tayo magsusupply sa labas. Tapos yung sariling atin, hindi natin masupply.
Senate Committee on Trade Chairperson Senator Coco Pimentel is also set to tackle the issue, noting that it is unfair for the factories that the government is not buying their outputs after efforts to repurpose. Jorlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Philippine National Police, or PNP, has refuted reports of alleged planted beneficiaries in its community pantries in different regions. Leia Ilagan will tell us why.
Pictures of an alleged memorandum coming from Police Regional Office 10 circulated online, ordering CAPs to ask their chosen beneficiaries to post their food pantries on social media. PNP Chief Police General Debolsina said there is no such order coming from him. Anduyan also denied issuing the said memorandum. He, however, confirmed that they coordinated with local barangay officials for their Bayanihan program.
Seek help dun sa barangay because sila nakakakilala kung sino yung mga taong needs help.
PNP spokesperson Police Brigadier General Ronaldo Olay meanwhile said that those police officers who took selfies of their activities did so for documentation purposes.
Kasi every after activity, merong after activity report ang mga units natin. Halimbawa, isang police station, nag-conduct siya ng barangayanihan. They have to submit after activity report. And what is the best form of proof na nakapag-conduct sila? So in the form of pictures.
Olay added that the PNP has been doing such charity work since 2015 under the Office of the Directorate for Police Community Relations, or DPCR. SINAS, in the meantime, ordered an investigation to identify the persons behind the malicious post against the police in relation to the community pantry.
It is not within the PNP to make such allegations na mga ganon. So we'll have the CIDG and Cybercan to investigate those so-called posts.
SINAS stressed that their efforts are for those who are in need of food and they are not favoring anyone for that matter. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
Meanwhile, Supreme Court Justice Rosemary Carandang has interpolated some officials of the Office of the Solicitor General in connection with the surveillance and designation provisions of the anti-terrorism law. Meanwhile, National Security Advisor Hermogenes Esperon Jr. will be questioned on the next oral arguments. Dante Amento tells us why.
Surveillance and designation under the new Anti-Terrorism Act are among the most assailed or contested provisions of the law. In her interpellation, Supreme Court Justice Rosemary Carandang asked Assistant Solicitor General Marisa Galandines on the probable cause for conducting surveillance against any group of individuals.
Must a group be designated first before its members can be subject to surveillance?
Must be designated first. No, Your Honor.
What do you mean, no?
Designation under 25 is not a condition precedent for surveillance could be conducted, Your Honor.
So surveillance can be conducted even before designation?
Yes, Your Honor. And in fact, after surveillance, Your Honor, this could in fact lead to a designation.
Galandines adds surveillance be done under an authorization from the Court of Appeals.
Again, is it the government position that no surveillance can be done without the CA authorization?
Yes, Your Honor. As provided for in section, this is one of the safeguards provided for by the ATA. This is provided for in section 16, that no surveillance can be undertaken unless there is a written authorization from the Court of Appeals.
Justice Carandang has pointed out that there are instances wherein authorities conducted a surveillance without any authorization from the court. The magistrate also asked what will be the consequences after a certain individual is designated as terrorist.
The designation would trigger the power of the AMLC to freeze the assets of the person or the organization designated as a terrorist group, Your Honor.
Meanwhile, National Security Advisor Secretary Hermogenes Esperon will also be asked in the next oral arguments in relation to the red tagging issues made by some government officials to community pantry organizers.
Several officials of the government have made statements associating the organizers of community pantries to the NPA. What is the basis of the government in saying that? Would you have an idea?
I have no knowledge, Your Honor.
You have no knowledge that the government, some government officials are associating people with good heart?
Perhaps we can consult the National Security Advisor, Your Honor.
The next oral arguments is scheduled on Tuesday, May 4, 2021 at 2:30 o'clock in the afternoon through video conferencing. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
Senate Minority Leader Franklin Drilon is urging President Duterte to certify as urgent his proposed bill seeking to criminalize red tagging. This comes after Justice Secretary Menardo Guevara's opinion backing the enactment of a law that will criminalize red tagging, noting that it may help reduce the problem of reckless endangerment. According to Drilon, Guevara's opinion acknowledges the gap in the law and the need to pass his proposed law. Under the Senate Bill 2121, any state actor such as law enforcement agent and military personnel who labels, vilifies, accuses, or harasses individuals or groups as state enemies or terrorists will face 10 years of imprisonment and perpetual disqualification to hold public office.
In other news, the Department of Environment and Natural Resources, or DENR, will issue a notice of violation against the ship owner who dumped oil and grease-contaminated water in Manila Bay. This comes after the result of a study showing a high fecal coliform count on the water sample taken in the area. Marvin Calas report.
The Department of Environment and Natural Resources seeks explanation from the ship owner who dumped wastewater in Manila Bay about a week ago. It comes after a confirmation based on a study conducted by the DENR Environmental Management Bureau that the wastewater is indeed contaminated with oil and grease. Study shows that the water sample taken from the area contains high fecal coliform. From a standard 100 most probable number, or MPN, per 100 milliliter, the water sample contains 2,400 MPN per 100 milliliter.
So with this result, nakita natin talagang yung kanilang wastewater is beyond the standard ng DNR. So on this basis, we can now issue a notice of violation against the owner, and then a technical conference will be called for them to give their side.
Next week, it is expected for the Manila Bay Coordinating Council and the Manila Bay Task Force to convene in adjudicating the ship owner's violations, the appropriate sanctions, penalties, and its fine imposition. Possible charges may include Clean Air Act violation, marine pollution, fisheries code, and other regulations of the Philippine Ports Authority. Meanwhile, Undersecretary Leones also clarified that the imposition of no berthing of sea vessels within the 2.5-kilometer distance from the Manila Bay shoreline is just a temporary measure while the rehabilitation in the area is underway. DENR also warned that the outflow of cooling systems of sea vessels berthing within the area are strictly monitored.
Kami sa Manila Bay Task Force, we are also monitoring the water quality dito sa Yacht Club. In fact, itong Yacht Club at saka itong Philippine Navy, itong Harbor Square, we are monitoring their outfalls. At may nakita kami diyang mga outfalls na nag-exceed ng ating standard, at na-issue na to ng LLDA ng Notice of Violations. We have also identified mga illegal pipes dito sa Harbor Square. We are now scheduling the sealing of these illegal pipes.
Despite the incident, DENR assures that the ongoing rehabilitation project of the government within Manila Bay is unhampered. Marvin Calas, UNTV, News and Rescue. We serve the people, we give glory to God.
The search is on for the next Philippine National Police Chief as General Debold Sinas is set to retire on May 8th. Let us know who are the candidates for the next top crop. Leah Ilagan reports.
Philippine National Police Chief Police General Debold Sinas have only more than a week in the service. He is set to retire on May 8. General Sinas said he had talked to police senior officers in his command conference last Tuesday, April 27.
Nagpapaalam na ako sa tropa that we'll be preparing for yung one big event namin is yung May 1. After that, we'll be preparing for any day na i-approve ng Malacanang kung kailan ang turnover.
Sinas mentioned he will not give a recommendation to the president for the next chief PNP. The country's top cap says he will leave it to DILG Secretary Eduardo Año.
Lahat naman na mga PNP dito, generals are capable enough to lead the PNP. And kami, we'll just wait for kung sino pong pipiliin ng presidente at siya po ang susuportahan ng buong PNP.
But who are the possible candidates for chief PNP post? Based on Republic Act 6975, the president may choose from a one-star general or brigadier general for the position. But if the PNP hierarchy will be followed, number 1 in the contender is PNP Deputy Chief for Administration, Police Lieutenant General Guillermo Eleazar, the number 2 man in the PNP organization. Eleazar came from the PMA Hinirang class of 1987. He is an expert in administrative work and operation and was formerly assigned to the Criminal Investigation and Detection Unit in Central Luzon and Central Visayas. Eleazar also became a liaison officer of the United Nations Cambodia. He also holds a logistic and controllership position in the PNP, became chief of Anti-Cybercrime Group, director of Quezon City Police District, and head of Metro Manila Cup or NCRPO. Eleazar received many awards and recognition for good work, and he is set to retire on November 13, 2021. Eleazar's mista and also a member of the command group will possibly be included in the next chief PNP list. They are PNP Deputy Chief for Operations, Police Lieutenant General Joselito Veracruz, the number 3 man of the PNP organization, and the Chief Directorial Staff, Police Major General Israel Ephraim Dixon, the number 4 man of the PNP. Aside from the members of the command group, name of NCRPO Director, Police Major General Vicente Danao Jr. also surfaced. Danao is from PMA Sambisig class of 1991. Trained in anti-terrorism and intelligence work, assigned in Davao when it was recognized as the 4th safest city in the world, appointed as head of the Counterintelligence Division of the PNP. He became Deputy Director for Operations of the Criminal Investigation and Detection Group. Danao also became a District Director of Manila Police District and head of Police Regional Office 4A or Calabar Zone. Danao is set to retire on August 10, 2023. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
And for the news abroad, Canada has reported its first death case of rare but serious blood clotting linked to AstraZeneca's COVID-19 vaccine. Ian De Vera will tell us why live.
The Quebec Health Ministry on Tuesday confirmed that the death of 54-year-old Francine Boyer was caused by a vaccine-induced immune thrombotic thrombocytopenia or VITT. Boyer and her husband Alain Ceres reportedly received their first dose of the vaccine in early April, and while her husband did not suffer from any side effects, Boyer was taken to the hospital due to extreme fatigue and headaches, and later died on April 23. Quebec Premier François Legault offered sympathy to Boyer's family and stated that while there are one chance in 100,000 that a serious complication like this could occur, They believe that the benefits outweigh the risks. Public Health Director Dr. Horacio Arruda also states that the possibility of complications like this occurring is very rare, and that it is important to weigh the risk of vaccination against the much higher risk of COVID-19 complications. Meanwhile, the Health Ministry of Quebec reports that more than 350,000 people have already received the vaccine in the province. Kath?
Thank you, Ia De Vera, for that live report. The well-known go-to video call application Zoom introduces a new feature allowing video calls to become more organic. Early Briones reports why.
Zoom announced last year at its Zoomtopia conference a new feature called Immersive View, which could make calls to feel a bit more in person. Although Zoom already has an existing virtual background function, this feature differs by placing participants together in a realistic-looking location, such as an auditorium or an office, without having individual participants change their backgrounds. The Immersive View function can be found at the top right corner, where the function speaker and gallery view are also located. This will also allow hosts to manually place and manage participants, as well as resize and upload their own custom backgrounds. In order to get the best and effective results, it is advised by Zoom that the app should be updated to the latest version, and custom images should be 1280 by 720 or 1920 by 1080 if the set camera has the ratio of 16:9. This feature will be made available for free and pro accounts, which will then cater for 25 participants attending meetings and webinars. Early Briones, UNTV News and Rescue. We serve the people, we give glory to God.
Americans who are fully vaccinated against the coronavirus no longer need to wear masks outdoors in most situations. Sonny Cos will tell us why.
Fully vaccinated Americans can now go outdoors without the need to wear face coverings, according to the newly released guidelines by the Centers for Disease Control and Prevention, or CDC. This rule, however, is only recommended if alone or in small groups. The agency still recommends wearing masks around big crowded settings or venues.
If you are fully vaccinated, things are much safer for you than those who are not yet fully vaccinated. This guidance will help you, your family, and your neighbors make decisions based on the latest science and allow you to safely get back to things you love to do.
Dr. Walensky added that the decision was driven by the declines in COVID-19 cases and the rising vaccination numbers. As of April 27, 140 million people have received at least one dose of vaccine, while more than 96 million are fully vaccinated. Meanwhile, President Joe Biden celebrated the progress of scientists and encouraged people to get vaccinated.
And because of the extraordinary progress we've made in fighting this virus, and the progress our scientists have made in learning about how it gets transmitted, earlier today, the CDC made an important announcement. Starting today, if you're fully vaccinated and you're outdoors, you need, and not in a big crowd, you no longer need to wear a mask. So for those who haven't gotten their vaccination yet, especially if you're younger or think you don't need it, this is another great reason to go get vaccinated now.
Sanicos, UNTV News and Rescue, USA. We serve the people. We give glory to God.
Those are the reasons behind the news in other parts of the globe. I am Kat Numaraos, live from Bangkok, Thailand. Good evening.
And those are the reasons behind the news, April 28, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.